Can someone get pregnant after using Sayana for 1 year? Will you be able to get pregnant after using Sayana for 1 year? Omukyala abuzize ekibuuzo mukwano gwaffe n'agamba nti asobola okufuna olubuto. Omukyala asobola okufuna olubuto wabanga akozeseza Sayana okumala ebbanga ery'omwaka gumu, obanga okozeseza Sayana family planning okumala ebbanga ery'omwaka gumu, ojja kusobola okubanga ofuna olubuto. Will you be able to get pregnant if you have used Sayana Press for 1 year? Sayana is a type of family planning which actually is given in form of an injection, and then of course it is injected on the outer part of your arm, and then it contains what we call medroxyprogesterone in a weight of 104 milligrams per 0.65 mils. So Sayana chika cha family planning era chirimo eddagala lyetuyita medroxyprogesterone. Eddagala lino eriri mu Sayana oba eriri mu kika kino kya family planning ey'empiso lyetuyita Sayana baliyita medroxyprogesterone era lizitowa oba lirina obuzito bwa 104 milligrams per 0.65 mils. So buli lwalaba akagundi aka Sayana kalimo 104 milligrams per every 0.65 mils. So obanga obadde ogenze mu ddwaliro ne bakuwa ekika kino ekya family planning kyetuyise ekya Sayana nobanga okifunye, kigenda kuba kiziiza oba kigenda kuba kistopinga ovulation, naye kigenda kuba kikolera oba kigenda kuba kiprotectinga against pregnancy for only 13 weeks. Sayana Press specifically protects you from pregnancy, or it prevents pregnancy for only 13 weeks. That is roughly around 3 months. Actually, it protects you for 3 months. So if you have been asking yourself specifically what will it do when you get this Sayana, what does it do to your body? Specifically, it stops ovulation. Oba ofunye empiso eneya Sayana kyekola mu mubiri gwo eziiza oba estopinga kyetuyita ovulation. Jukira, ovulation is the release of a mature egg, and this happens on the 14th day. So empisa neya family planning gyetuyita empisa ya Sayana eda twali tugiyita Depo-Provera. Twali tulina ekika kye bayita Depo-Provera naye kati Sayana yaliko. Specifically kyekola egenda nebanga eziza eg obutavaayo kujja kusisinkana nkwaso za musajja, thereby preventing or protecting you from pregnancy. Preventing pregnancy is the right word. So Sayana Press specifically ebegenda kola ki? What does Sayana Press do to your body if you are taking, or if you have got the Sayana? What will it do to your body? What about everything about Sayana Press and what it does? We've said that it stops ovulation. Njogedde ku Sayana kyekola ngambye nti stopping ovulation, of course nebanga eziza omukyala okufuna olubuto. But the question was, can someone get pregnant after using Sayana for 1 year? Ekibuuzo kibadde nti omukyala asobola okufuna olubuto abanga akozeseza Sayana okumala omwaka omulamba. Imagine you have been stopping ovulation for around 1 year and you are asking yourself, will you be able to get pregnant? The answer is that yes, you can get pregnant after using Sayana for a period of 1 year. Osobolera ddala okubanga ofuna olubuto obanga obadde ku kika kino ekya family planning kyetuyita ekya Sayana, naye kyokka kyolina okola kyekyokuba nti gumiikirizamuko mu bbanga ery'emyezi 3 oba mu bbanga ery'emyezi 6 empisa yonna ng'ewedde mu mubiri gwo. Okay, osobolera ddala okubanga ofuna olubuto. After using Sayana for 1 year, you actually need to be patient. You need to wait for at least 3 months or even 6 months, thereby you'll be able to get pregnant. This time allows this injection or this type of family planning to actually get depleted out of your body. So you need to have some patience. Be patient, wait for some 2 to 3 months or even 6 months, or even actually some clients, some women wait for up to 1 year for this family planning to be out of your body so that they can actually get pregnant again. Osobola okulindako ebbanga ery'emyezi ng'esatu oba omwaka omulamba nobanga ate osobola okubanga oddamu nobanga osobola okufuna olubuto. So I'm talking about Sayana as our main topic for today, and how soon will you be able to get pregnant. But we cannot finish this video without talking about who should not use Sayana type of family planning. Ani atalina kubanga akozesa Sayana family planning method. If you are actually someone who has a bone disease, obanga olina obulwadde obw'amagumba, okay, you have a condition whereby there's what we call reduced bone mineral density. Obanga olina ekirwadde ky'amagumba whereby amagumba go ganguwa okubanga gafuna fractures, obanga amagumba go galinamuko obuzibu, kyandibadde kirungi n'osooka nobanga oyogera ne doctor wo nga tonafuna empisa eno. If you have a history of bone disease as a woman, make sure that you actually talk to your doctor about Sayaana before you get this injection, because one of the side effects are that it could actually reduce your bone mineral density. It could actually cause more serious issues for you if you have bone disease. Remember, my videos are for educational purposes only. Videos zange za kuyigirako buyigizi, za kusomerako busomezi, so making sure nti ogende wa doctor wo yeyongera okubanga ate akuwabula kweyo ensonga oba ku nsonga yona gy'oba olina. So Sayana Press, Sayana family planning. I'm talking about who should use Sayana family planning and who should not use Sayana family planning. So if you do not have any issues with bone disease, then you can actually use Sayana family planning method. Obanga tolina bulwadde bwonna na magumba, tolina bulwadde bwa magumba, osobola okozesa Sayana family planning method. And then the next category of people who are not supposed to use Sayana family planning are those who are actually having unexplained bleeding from their private parts. A woman who is bleeding from her private parts and then the bleeding is not explained, there's no cause for it. It could be a sign that probably you may need to go for routine screening for cancer of the cervix. And remember, if you are having unexplained bleeding, make sure that you go for routine screening for cancer of the cervix, and in this way you actually do not qualify to use Sayaana. Obanga obadde oli mukyala olinamu ekirwadde ekyokubanga oli ku bleeding nga tukiyita unexplained bleeding ng'ate tomanyi bleeding eno oba omusaayi guno guli kuva kuki, mukono gwange tolina kubanga okozesa Sayaana kuba ate eyinza okubanga ate tekuyamba ennyo. Obanga olina bleeding okuva mu bitundu bye ebyekyama, genda ewa doctor wo yeyongera okubanga akucheckinga alabe biki kyennyini ekiri okuleeta bleeding eno nga tonagenda ku kika kino ekya family planning ekya Sayaana. Next category of someone who is not supposed to use Sayaana is if you actually have been diagnosed with any malignant condition. Wabanga bakugambye nti olinamuko ku buzibu obukwatagana n'ekirwadde kye tuyita malignancy, obanga olinamu obuzibu nga bakugambye nti wandibanga olina cancer ow'amabeere, obanga wandibanga maybe oli ku treatment eya cancer, making sure nti weewala Sayaana kuba eyinza obutakuyamba ennyo. If you have a malignant disease, you actually do not qualify to get Sayaana. You need to confirm with your doctor before you actually start on this type of family planning. And then of course, if you are actually having issues with your hormones, if you have hormonal issues, then you actually still should be able to consult your doctor before you actually start on this family planning method, because if you are having hormonal issues, these need to be treated very fast before you begin on this type of family planning. Because remember, it's also a drug, or it contains medroxyprogesterone, which can actually be used in combination with estrogen to act as a hormone replacement therapy in case you have any issues. So jukira obanga obadde olinamuko ku buzibu ne hormones, olina okumakinga sure nti okonfaminga ne doctor wo nga tonakozesa ekika kino ekya family planning kye tuyita ekya Sayaana. Remember, my videos are for educational purposes only. We've talked about who should not use Sayaana. Njogedde ku ani atalina kubanga akozesa Sayaana. So we are going to talk about the next category of people who are not supposed to use Sayaana. If you have a cardiovascular disease, obanga wagenda mu ddwaliro doctor wo n'azuula nti gwe ng'omukyala olinamu obuzibu ne kye tuyita cardiovascular disease, endwadde eza blood oba endwadde ez'omusaayi, katugeze endwadde entambula ey'omusaayi, cardiovascular disease, endwadde nga pressure. Okay, obanga obadde bakugambye nti olina pressure, ogenze ne bakebera eri mu 180 out of maybe 100, pressure zo ziri waggulu, kyandibadde kirungi n'osooka n'oyogera ne doctor wo nga tonatandika ku kika kino ekya family planning. So Apart from these few words, I am really so happy that you've stayed with me for this video lesson about Sayaana. I believe by now you know that you actually, if you have any of these issues, you should actually not use Sayaana. But if you do not have any of these, then you can use Sayaana. Obanga tolina buzibu bwonna na bleeding, tolina pressure, tolina buzibu bwonna na magumba, bone disease, you can actually use this type of family planning. Nungi nnyo.